The Case Manager of the Year award is presented annually to an inspirational leader whose contributions and dedications to the future of case management have made a positive impact on others and on the profession as a whole. Through strong leadership qualities, the encouragement of others, and continued commitment, each recipient exemplifies the highest quality of case management. Primary criteria for this prestigious award includes leadership activities within case management profession, which have resulted in significant influence of the industry. Recipients demonstrate mature and effective professional skill, leadership abilities, and vision. Let's meet our 2017 Case Manager of the Year.
This year's Case Manager of the Year, Ellen Aliberti, has a reputation for her passion, drive, motivation, spirit, energy, humor, and advocacy. A colleague quoted her as the epitome of the role model for case management. Ellen graduated nursing school in 1978 from Mount St. Mary's College. She soon took a more independent role in her career, and in 1987 became the first AIDS case manager in Orange County, California, during a time when AIDS created psychological issues that complicated the disease. Over the last 30 years, she has worked in case management within many healthcare settings, serving in various leadership roles. She established a case management program providing hands-on care and support to both patients and their loved ones. While working with the Visiting Nurse Association, she soon discovered her love for working with the elderly, which led her to secure her master's in gerontology in 1993. This credential, coupled with her case management and managed care experience, allowed her to begin to participate on national committees and consulting opportunities for training pathways and care management program development. She is a certified case manager and currently the clinical educator for DaVita Healthcare Partners, Nevada, where she is responsible for both medical assistance and nursing staff clinical education training. Ellen is the founding president of the Case Management Association of Las Vegas, where she was instrumental in building the professional case management community through her passion of teaching, educating, and supporting the case managers. Hear what her friend, colleague, and co-conspirator, Marcia Anderson, has to say about the impact Ellen has made on the Las Vegas case management community.
We also started the CMA-LV chapter for CMSA. I worked behind the scenes with bylaws and incorporation, but Ellen recruited the first leadership team and has been an integral part of the team since the inception. Today, CMA-LV would not be standing if it were not for Ellen's efforts, and now we are proud to say there are over 100 CCMs in the state, largely due to her efforts.
A fellow chapter leader, Casey Lepore, reflects on Ellen's passion.
Ellen's passion for case management is instantly evident. She has the unique skill of using her passion to inspire and mentor others, including me.
Over the past couple of decades, she has also served with other organizations, including the Practice Change Fellows, the Robert Wood Johnson Foundation-sponsored HMO work group on case management, and the March of Dimes. Through the South Nevada chapter March of Dimes, she received the Nurse of the Year in Managed Care and the Nurse of the Year in Education. She currently serves as the chair for the March of Dimes Nurse of the Year Committee and as a member of CMSA's editorial board. Also, Ellen is a prolific writer and has published and/or contributed to several articles, white papers, as well as a CCM study course. For 13 years, Ellen served as a member for the Practice Change Fellows program. She worked with nurses, social workers, and physicians to develop leadership skills, educate on case management, and to build managed care strategies for population management. Dr. Eric Coleman had this to say about Ellen.
Well, I'm truly proud to call Ellen both a colleague and a friend for over 20 years, and I promise I'm not out to embarrass her, given how reserved and demure she is. But of her many accomplishments, I'd like to highlight Ellen's impact as a mentor. She was a phenomenal contributor to our Practice Change Leaders program and has influenced generations of interprofessionals who look to her for guidance and whose careers essentially were launched thanks to the expertise that Ellen offered.
Ellen was born and raised in Southern California with 2 brothers and 1 sister. In 1971, her father was one of the first 100 people in the U.S. to have open heart surgery. This had a profound effect on Ellen's decision to become a nurse. Her mother was a great mentor as an amazing caregiver and helped Ellen realize how critical caregivers are to the patient's overall success with a long-term, chronic, or terminal disease. When Ellen was asked about the milestones in her career, she says that one of her most pivotal moments occurred when she attended her first CMSA National Conference. Every year she attends continues to have a profound effect. She knew instantly that CMSA was the professional organization for her. When Ellen is able to step away from her healthcare world, she loves to golf, bicycle, and swim. Being a native California girl, she loves both mountains and the ocean. Ellen also enjoys writing song parodies and has written over 200 songs. She recently celebrated a 19-year anniversary with Nancy, her best friend, touchstone, and life partner. It is with our pleasure to welcome to the stage the 2017 Case Manager of the Year, Ellen Aliberti.
Wow, thank you so much for that great reception. Terry and Susie, just before you leave, are you sure that you read the card right? I think I saw Steve Harvey lingering in the auditorium. No, seriously, I am really so thrilled and honored to be your 2017 Case Manager of the Year. And if the truth be known, it has been a dream of mine since I attended my first CMSA conference. I think back then it had to do with the deep, commanding voice of the announcer. However, in accepting this award, I really would be remiss if I didn't first acknowledge the incredible administrative leadership of CMSA, past and present, right? To Jeannie Bowling for her vision and dedication, excuse me, in creating CMSA. To Sherry Latimer for her determination to secure CMSA on a national level. And to Kathy Frazier, who I met many moons ago at a CMSA conference. And I remember discussing with her the challenges facing the chapters. And she indicated to me back then, just first on the board, that was going to be one of her #1 focuses. And I'll tell you, and I know you would agree, has she ever wavered from that? No. And her passion for case management. So thank you, y'all. I also want to thank in general all of our national and chapter leadership for your commitment and dedication. You are the Purkinje fibers of this organization, continually fueling the passion for case management in our local communities. Thank you. You know, receiving this award has given me the chance not only to reflect on my career milestones, but also my long-standing commitment with CMSA. What soon became crystal clear to me is my affiliation with CMSA has given me far more than I could ever dream possible, and certainly much more than I've ever given back. Treasured friends, amazing networking, practice-changing education, and tremendous growth opportunities. Yet, my first exposure to case management occurred without me even knowing about it. Mount St. Mary's School of Nursing used the Roy adaptation model of nursing. It was a theoretical framework developed by our president of Mount St. Mary's, Sister Callista Roy. We considered the patient as an interrelated system, biological, psychological, and social. I think spiritual was just a given because it was a Catholic college. But clearly, these tenets for assessing our patients are obvious to us today, but we're talking about the 1970s. We didn't even have computers back then. And I remember I was writing a care plan. We used 11 by 17 reams of paper, right? And I once had 75 interventions and reasons for a low potassium. Yet despite killing that small forest, I completed my BSN program, but the approach that I learned resonated with me, and I went out and set out to change the world. First stop, my local community hospital, where I had been a candy striper, and may the minutes reflect the only time I was in a striped uniform. I was also a candy striper. Can you believe they let us feed the patients back then? No training. You want to feed? Yeah, you go feed. Okay, I'm feeding. Yeah, I was also a scholarship recipient from this hospital, so I felt like I was owed them something. Probably they gave it to me because I was willing to feed the patients. And I also learned how to be a CNA on the job, which wouldn't happen today as well. Anyways, I was on the floor, med-surg, for about 5 months, and then I was asked if I would go to oncology because one of the regular nurses was going on maternity leave. And of course, I jumped at the chance. My first day there, I cared for a woman that had terminal lung cancer. She was taking her 4th round of chemo, and she expressed to me that she was tired of being sick, she was tired of being in pain, and she wasn't sure she wanted to continue. So I added end-of-life care planning to the care plan, right? Yeah, ooh, wrong. So apparently, back then, the oncologist actually read the notes. So when I returned from my shift the next day, I had to meet with the nursing supervisor, and she counseled me about my care planning and thought it best I move back to med-surg. I was stunned, and I vowed at that moment in time that I was going to get out of there as soon as I can, even if they let me feed patients. Done. And moving on I did. 1981, I became LNA of the VNA. It's got a nice ring to it, right? Ooh, I loved it. Where individual care plans were a requirement, where patient and caregiver education and community resourcing were essential to help patients self-care manage. I spent 7.5 glorious years with the VNA, where I witnessed the same strength, valor, and amazing resolve that I saw in my own family experiencing my father's long-term illness. My last 4 years at that VNA, I was stationed to the UCI Medical Center, OC's County Hospital. I was housed in the social work department, and I was like a sponge. I learned everything I could about entitlement programs, about the care continuum, and how important yet challenging it was to effect seamless care transitions. It was here that my career path was solidified. Me and my Roy adaptation model of nursing had found a home. And it was certainly not called case management back then, but it was what we did. And just in time, because the AIDS crisis was hitting the United States in ways that we couldn't even imagine. The 60 men that I had the privilege and honor of working with when I was at ASF did transform my case management practice forever. And they also spurred me on into the political activism for healthcare inequalities. We only had 2 drugs to treat HIV back then. It was AZT and pentamidine, and we certainly did not have enough to go around. As a case manager, I saw families becoming torn apart as they began to process the magnitude of their son's diagnosis and its implications. My experience at ASF underscored forever that patient advocacy is paramount, and patient choice ought to be the only one that we consider, not the doctors, not the case managers, and really not the distraught families and friends. The only one that truly matters is our patient. In 1991, that's right, little millennials out there, get out your calculator. In 1991, I attended my first CMSA conference. I was blown away by the sheer magnitude of the membership, the brain trust of our thought leaders, and the heartfelt passion of my fellow case managers. This experience had a profound effect on me and lasting, as evident by my continuous attendance at every conference subsequently since my first inoculation. Thank you. Over the next 2 decades plus, much of my innovation in my own personal practice and the organizations for whom I've worked has been a direct result of my education and participation in CMSA. CMSA has always been a mecca for exposure to new medical technologies, patient management tools, and critical knowledge, thereby assisting me to stay informed and current in my practice. Consequently, I was active and involved in the Southern California chapter of CMSA for 15 years. I know they're out there. Thank you. Before I moved to Las Vegas, I followed my colleague Marcia Anderson there to build an inpatient case management and hospitalist program. Our plan was to only hire CCMs. Sounds perfect, right? Oh, so imagine our dismay and disbelief when we didn't even have a chapter in Nevada. And furthermore, Marcia and I were 2 of the 6 registered CCMs in the whole state. But like good case managers, we always have a plan B, right? Right, so ours was to grow our own, and frankly, that was the impetus for CMALV. My involvement with CMALV has been an amazing journey, and once again, the experience of creating a new chapter and developing our members has given me much more than I could have ever dreamed possible. In particular, I want to shout out to Marcia Anderson, who has become a lifelong friend and mentor. I want to also acknowledge our very own Gen Y, Casey Lepori. Yeah. Let me begin by saying that every chapter needs a Casey Lepori. She has brought every technology advancement we've had since we had our fax machine and we had a P.O. box. And then Casey came along. I have no doubt Marcia, would agree that Casey is our finest grasshopper. Yes. To Sandy Blake, our other tireless CMA LV director, I'm so appreciative of your continued commitment and your incredible networking abilities that have served our chapter well. Thank you, Marcia, Casey, and Sandy, for all the riches you have given me and our Southern Nevada community. And to all our chapter members and friends, thank you for the privilege and honor to work with you and allowing me to fulfill my lifelong dream of being the change in the case management world I want to see. We have come a long way, Vegas, and we will continue to thrive. To the clinical leadership of DaVita Healthcare Partners for allowing me some wonderful opportunities to educate and mentor our case management teammates, thank you for seeing my value. To my parents and my siblings for their many sacrifices and your unwavering support that allow me to pursue my dreams of being a nurse, of being a case manager. Thank you for your unconditional love, even when I was Nurse Ratchet. I want to thank my wonderfully gifted and amazing talented life partner, Nancy. Imagine listening to me drone on about healthcare and case management for 20 years, right? Thank you. I mean, heck, I've only been talking for less than 5 minutes and you want me to shut up already, some of you. I know you do. Finally, to all my case management colleagues, just some words of advice or just thought. Remain vigilant in demonstrating your value to the bottom line. Today's healthcare system is being measured by the quality of the patient experience, as evident by the 5-star program of CMS. Therefore, it is incumbent upon all of us to substantiate our vital role in the patient engagement and patient-centered care. What's measured is treasured. Commit to lifelong learning and refinement of your CM practice. Internalize our standards of practice and continually challenge yourself by taking advantage of all the resources and riches that we have in CMSA and our local chapters. In other words, max pack your own ROI in CMSA. Take risks and seek out new challenges. Our chosen field is so rich with opportunity that spans the entire continuum of care. So take advantage of the flexibility that case management affords you. Spread those wings and soar. Get involved around a healthcare disparity that you're passionate about. ACT UP is a natural progression for patient advocacy. Woo! Yeah. All right. 2 more. Harness your power as a negotiator, as a facilitator, as an innovator, a patient advocate, a case manager. Know a case manager is one of the most innovative, dynamic, and significant roles in healthcare. Live it, flaunt it, and own it. Finally, okay. Finally, my wish for those of you who are young in the case management field, that you also realize case management is your vehicle to be the Uber change in the world you want to see. Thank you so much.